So mesothelioma is a really hard disease to treat. It's caused by asbestos, and on the south coast when we had shipyards, a lot of individuals were exposed to asbestos many years ago. And it takes 30 to 40 years from exposure to actually get mesothelioma. And essentially you can think of it as the cancer of the lining of the lungs. There's about 2,500 cases a year, and there's 6 times more mesothelioma now than there was in the 1970s. Nivolumab is an immunotherapy, so it's a drug that can activate your immune system to fight the cancer. The CONFIRM trial, funded by Cancer Research UK and Stand Up for Cancer, randomises 332 patients to either nivolumab or placebo, and we follow them up to see whether they progress or the length of survival. The trial found clear evidence of benefit. Giving nivolumab showed a 28% reduction in risk of dying and a 39% reduction in risk in the disease progressing, which for a disease in which we haven't found any significant benefit for other treatments is a real big step forward in the treatment of patients with mesothelioma. I think this is fantastic news. What it shows that if a patient starts chemotherapy and that doesn't work, there's a real option of an additional treatment in immunotherapy that can add benefit. So what we're doing is we're following up patients for much longer term to see how long the benefit of nivolumab works. The other work we've done is patients have donated blood and cancer samples, which we're looking at the laboratory to learn whether some subgroups of patients will benefit better. We're also thinking about the cost impact, because we know that we need NICE to approve drugs, not just based on benefit, which we've seen in this study, but the cost related to that benefit as well. And we've started the steps to design the next study. So what we're doing is we're looking at new drugs that we can combine with this immunotherapy to test in further clinical trials to hopefully even increase survival rates. We're a Cancer Research UK clinical trials unit, and all our funding is from those Cancer Research UK fundraisers and shops and donations that allows this research to take place. So to actually use that money to undertake a clinical trial that shows that a new treatment is safe and clear evidence of benefit is fantastic news, because we know that this has a clear path for patient benefit for patients in the NHS.